welcome to a very special episode of Leadership Lens, our engaging and innovative vlog series that delves into the dynamic world of diversity and inclusion, featuring insights from leaders shaping the future across various public sectors. For episode 3, we have a special Black History Month episode. So at Gatorby Sanderson, we are deeply committed to addressing key issues, and this Black History Month, we are focusing on health disparities within the Black community. This initiative aligns with the Black History Month theme of reclaiming narratives, where we're aiming to challenge existing healthcare inequalities and spotlight the leadership driving positive change in that space. I'm Jade Beckles, the Equity, Diversity and Inclusion Manager here at GS. And in this episode, we are honoured to feature Professor Dame Donna Kinnair, a distinguished leader in healthcare and public policy. As the former Chief Executive and General Secretary of the Royal College of Nursing, Donna has held numerous influential roles in both clinical and leadership capacities, including Clinical Director of Emergency Medicine and Executive Director of Nursing. She's championed health equity throughout her career, particularly in areas such as maternity care, child protection, and race equality. With over 3 decades of experience, she's contributed to key public health initiatives and advised on national policies, including the Prime Minister's Commission on Nursing and Midwifery. And she now leads as chair of the Runnymede Trust, working to address racial inequality. Welcome, Donna, and thank you so much for joining us today.
Thank you, Jade.
Let's dive into the questions. So firstly, what are some of the core values that have guided your leadership style, and how have they informed the creation of meaningful outcomes in the day-to-day operations of the organisations that you've led?
So I think one of the core values that's underpinned my leadership style is respect for people, and that is people in every guise really, but actually as a trained health visitor, inequalities in health have actually been one of the things that have spurred me on really, because in terms of respect for people, it is about making sure that there's equitable provision for people who have needs. And so that includes listening to the concerns, the needs of populations. You'll know, as a health visitor, we're mainly concerned with communities and population health and meeting the needs of those individuals. I think for my teams, I've always tried to be really supportive. You know, there's a measure of humility that when you're a leader you have to have, which includes listening to others, and helping you to understand how you can improve things for them. And I think as a leader, you're really trying to encourage and foster that innovation and change and improvement in the lives of others. I think being a visual leader, I'm quite a visual person. I think many nurses who do observations, who look at children, who look at things, are visual. And I think part of what you want to do is what you can see, you need to share with others and allow them to help you shape it. So I might be able, if I took an example in my career many years ago, I remember thinking, oh my God, why have we got a high infant mortality rate amongst Black babies in a particular borough that I was working with? And of course, I don't know the answers immediately, but we've got to do a plan with others about how we're going to get to the bottom of understanding this. What is the study that we're going to look at? And then what are we going to do about it that makes effective change? So I know we did a huge ONS study looking at the factors that were affecting this particular population of young babies in a particular neonatal unit, made sure that we looked at everything that was related. So birth, you know, what factors were affecting their birth, what factors were affecting their perinatal period, in terms of maternity services, how were their parents accessing it? Because we knew that there was a direct inequality in health because it was just Black babies that were being affected. So actually to get to the bottom of that, there's a huge amount of work. And then it's making sure that you work with the community to co-produce it, so that you get the interventions right. Because what I think might work for someone doesn't work for them from their perspective. So it's hugely important to co-produce. And I think making sure that we've got good communication, good relationships with our communities, that they don't feel worried about coming to ask you or to interject into what it is you're doing that may not be quite right. But I think that's how I've tried to get things done for improving health.
Absolutely. And I think what you were saying about the respect, that's a big part of that, isn't it?
Mm.
Because we're a proud people, and the empathy and the care is vitally important, but so is the respect piece as well. Thank you. So you have achieved so much in your career, from advising on national policy to be a leader during the pandemic. What inspired you to pursue leadership in healthcare?
That's an interesting question because I don't think I ever aspired to be a leader. In fact, I was really happy. Some of my happiest times have been at being a bedside nurse and working with individuals in communities and looking at population health, going into schools, the huge variety of things. But I think there have been particular times in my career when I felt really strongly about something. And that strength of feeling makes you want to do something about it. So, of course, when you've got that overwhelming strength of feeling, you have to speak out. You have to want to make the changes. And, I can remember as a health visitor going into a home and seeing a particularly large family at the time in the East End of London living in the most appalling conditions, water running down the wall. And actually seeing one of the particular children the family dealing with something I hadn't seen. I'd seen it when I worked in Africa and some parts of the Caribbean, but actually a child with what we would call today marasmus, which is a form of malnutrition. You don't really see that, but actually that was existing in the East End of London.
Wow.
We've been so furious about it that I wrote to the Director of Social Services, and I remember putting in the letter, don't come back and tell me about housing acts. I'm talking about real people with real lives. And that resulted with him calling me in to give an explanation about this letter that I'd written, which was I was furious when I wrote it. But I think I was talking about real people with real lives, and I wanted to convey that to other people, and I wanted an intervention to happen for this particular family. So there have been many times, my road to leadership is more in response to the the passion that I feel and the need to effect change. So, I remember being on the Victoria Climby inquiry, and it took until then really for me to think about doing a role in leadership. But I was so upset about the way that nurses were being treated, and at that time sprouted out into general management. But I remember sitting at that inquiry, watching some things that I was not happy with, and I remember saying to a QC, "You've got that completely wrong. Can you call that person back tomorrow and ask them that question because it couldn't have been her responsibility?" And he said, I showed him all the evidence that I'd acquired, and he said, "Right, you're right. I'm going to call her back in." And it was a nurse, and she accepted all blame. Oh, she couldn't actually see past the fact that she was totally responsible and that the
Yeah.
blame belonged to her. And that left me feeling like I kind of need to educate people in my profession. Now, obviously, I've done law and I've done ethics, and I thought, well, I could use those skills better. And that prompted me to want to become a director of nursing.
And I feel like that makes the best type of leaders, the ones that are driven by the passion, and who are being inspired by the work. Absolutely. And I really resonate with what you were saying in regards to real people, because I think sometimes we deal with a lot of statistics, stark
Mm.
statistics, especially
Mm.
when we're talking about disparity. But I just think it's really important to remind people that there are real lives and real people and real faces behind those statistics as well.
Mm. Yeah.
Absolutely. Thank you. Um, So, what strategies would you recommend to health leaders to ensure that public health messaging, I suppose, on all disparities within the Black community, is resonating with the Black community to improve those outcomes? And I suppose how can they increase the trust that the Black community has in the healthcare system?
So you only increase trust by doing the things that you say you're going to do on behalf of people.
Consistency.
Yeah, and negotiating with people. So in a way, and this is really stark, you absolutely need to build a relationship with communities. You need to be able to build a relationship with um, anyone that does community development work knows this, that you can't just go in and tell someone what to do in a community and they're going to jolly well go along and do it. So I think there are some tried and tested methodologies, and COVID is a stark example. It taught us so much about the lack of trust, particularly in our communities, that people have in the healthcare system. You know, I can remember in COVID, I went to the supermarket and there was a black woman that said to me, "Don't take the COVID injection. You know, and they're absolutely going to put something in your body that, you know." And that was the belief, and it wasn't held by certain countries that think that they can test on African people vaccines, or you know, you remember the
Absolutely.
French episode where the French doctors were thinking that they could roll over to Africa, and the you know, had to say, they were told actually that this is not appropriate to be testing your vaccines on others. So I think it taught us a lot. And for me, I think there was an important role. I remember one of my son's friends, who is a doctor, rang me up and said, "Look, I'm doing some work with the community. I was the chief executive of Royal College of Nursing. Would you join me on that podcast or, you know, a workshop with individuals?" And we were doing it online. But first of all, you had to listen to their fears. What is it that they were so anxious about? Why is it they didn't trust the system? And I remember
Yeah.
we had a microbiologist that actually explained the microbiology of COVID, or the way in which COVID worked. And then, you know, it is important to arm yourself with the data and the facts. Um, and but recognizing, and that whole bit about respect for persons,
Mm.
is you have to have the humility to recognize that it's important to allow self-determination. So it's important for us as clinicians and others to nudge, marshal a credible argument as to why one course of action is better for you than another, but also doing that with humility and respect. Um, and, you know, addressing sort of inequalities in health doesn't lie at the door of, of just one particular part, and recognizing that prevention, all sorts of things are, you know, going back to childhood. I'm really passionate now. I think I've, throughout my career, I've worked with children, then I've worked with adults, I've worked with older people. But it's so important that early intervention, that whole bit about, you know, how do we deal with some of the determinants? How do we do the things that people recognise, that nutrition, housing, all of those other things, fuel poverty that exists in our society, means that for people, the focusing on immunisation might be the last of their worries
Mhm.
when
Mhm.
they're, you know, and so we do have to recognise that you can't focus on education if you're hungry. So there are other, the wider determinants of health is so, so important. You know, and I would have said this to you years ago as a health visitor, but it feels like we're here pushing an agenda without taking into consideration the other factors. And I
Yeah.
know that when we did this work in COVID, and we started off with nobody wanting to. I did lots and lots of podcasts and lots of workshops in COVID, where people were saying, "Well, I definitely wouldn't take the immunisation." But when you went through the facts, the data, that it is up to them, it offers you a chance. Why, you know, the COVID virus was so difficult to contend with, and how it kept changing, so that people actually understood that we weren't doing this to push a vaccine that was putting something into somebody's body, but
Mm.
actually we were doing that in the course of saving lives. So for me, you know, there's many aspects to this. There's early intervention. You know, you can't sit here and say to people, trust me in the last hour, when actually for the most of the things that we've been doing, we haven't fostered co-production, we haven't fostered trust, we haven't been transparent. And recognizing where many communities, particularly, you know, my communities are coming from when they feel that you're trialing vaccines on them. And let's not hide it, that it was a big experiment, the COVID vaccine.
Yeah, that
Um,
acknowledgement.
we have to acknowledge that. So, yeah, I think that it is about building trust. It is about listening to where people are. It is about using data and evidence, and you know, to help them understand where we're coming from.
Absolutely. I so agree because I had those same conversations in my household, like with my dad, who's a proud Jamaican man, and he has COPD, and really, I really wanted him to be safe. And then we need to, I think that acknowledgement of, and I suppose it comes back to respect as well. It's respect that his morals and his values and that generational trauma runs deep. And when he spoke about the history of vaccines on Black communities, it was a real fear for him, absolutely, and it was acknowledgement of that and respect of that as well, you know. And no matter how much I'd speak to him, he said, "Why for that? I'm not taking that," you know. And he did in the end, but it took time and it took fostering that trust, like you say. And yeah, no, I completely agree. Thank you so much for that. Um, So, in recent years, there has been an increasing focus on addressing maternity health disparities, particularly with Black women and other women of colour. Um, you know, I think by now most of us should have watched the documentaries and we've seen the stats. But from your perspective, what changes or improvements have we seen recently in maternity care that are aimed at reducing these disparities? And what do you believe, what work do you believe still needs to be done?
So we have seen a lot of things focused on it. I mean, I'm the maternity champion at a nearby trust, so I'm forever running into maternity services and looking at what's going on. And God, oh my God, they are busy. So sometimes there are different sit reps throughout the day, making sure we've got a status on what's going on in unit, so people are on top of it. We have had, everybody knows the stats for, particularly for Black and African women and others. So that is about increasing awareness in the communities, because when you increase awareness in the community, it means that you give people, or you empower people to be able to challenge. So, you know, I've been doing a lot of work recently with the Borough of Southwark, and we've looked at co-production in terms of what are the communities saying about what is really happening in maternity. And I think that there are huge amounts happening. NHS England has a whole programme. I actually worked on better childbirths with Baroness Cumberledge some time ago, and there was a whole lot of recommendations put in place around trying to develop continuity of care for vulnerable groups. So lots is happening. But in my recent experience, one of the things that I was struck by is the amount of women of colour that do not feel listened to. That I can't tell you, almost everybody where we had, sorry, I've got cats fighting in the background, two kittens, where we had, to break this bite up, where we had women's experiences were saying, well, you know, I went in, some women actually felt that they were invisible in terms of the delivery of care. And that is a real sort of concern for me, because, you know, as I started this, when we started speaking, observations is hugely important to what you do as a nurse and a midwife, and listening to people. You can't observe someone unless you hear their story. So, you know, the amount of women that said, I knew there was something wrong, but nobody took me seriously, I think is stark. And there
Yeah.
also, and to me, there needs to be a huge amount of effort put into cultural competency, making sure. But let's not skirt around the bush. Racism seemed to be a huge part of what women were experiencing, and so one of the things that we know is that some of our systems in healthcare weren't created to deal with everybody. They were created to deal with a certain type of people that resided in this country before the 50s. Um, let's not, we have got to make a service delivery that is inclusive and that people's point of view is heard and people are empowered to give their point of view about what's happening in their care. So I've spoken earlier about my belief in self-determination. Well, you can't acknowledge that unless you work with people. And then that whole issue about, are we collecting the right data that enables these women, enables us all really to move the dial on the 3 times, the mortality and morbidity that Black women are facing. So there's a lot of sub details like, what are the major illnesses? How is the community participating in dealing with some of those high risk conditions? And then, of course, we have the issue that we know that so many more women are giving birth at an older age now. And by that older age, there are many long-term conditions that are setting in that you don't sort of experience when you've got a younger age group giving birth. And actually, I think it's essential that those that are taking part in the birthing as midwives and others are educated in these issues, because it's going to be essential for them to be able to look after people, understand what ill health, what happens when you've got ill health and you're going through childbirth and 9 months of pregnancy, and the impact, the risks that can happen to you. So for me, I do think there is a combination of factors that we have, and I think women need to be supported. I think our midwives could be better trained. I think some of the things that we've seen recently, and I don't want to knock midwifery training, but you kind of do need to understand that not every woman is starting from healthy pregnancy, that there is a lot of health, and that we do need to understand what the deteriorating patient looks like and what
Yeah.
happens. And then I think finally there's got to be a huge amount of input into the workforce. So we know that it's difficult to recruit midwives. We are missing a trick on some of those older women that with lived experience that used to come into midwifery, because with the fact that nobody's wanting to take out thousands of pounds of loan in order to
Yeah.
study it now. So there are lots that we can do in the need to support the workforce to, first of all, be attracted to do midwifery, but also wanting to stay in the midwifery service. So other things like better terms of pay and conditions, and I would say that wouldn't I, as a former chief executive of the trade union.
No, absolutely. And I think I just wanted to say a consideration for me as well is the mental health support for Black and brown mothers during pregnancy as well, because I've had fortunate enough to have two beautiful babies, and I agree that the pregnancy and the childbirth in both cases was not easy, um, down to my experience at that time. And um, although physically I came out of it okay, mentally, the impact of racism at such a vulnerable time as well when
Mm,
you are
mm,
pregnant,
mm.
I'd feel like that definitely needs work in terms of what mental health support. And I think what made it worse for me is that I was aware of those statistics, especially the second time round, which was terrifying. It was
It is.
empowering because I
Mm,
definitely went into every appointment saying, "You will listen to me."
mm, mm.
But it was terrifying, you know?
Mm. I think, and for many women, I mean, childbirth's terrifying anyway,
Mm,
and it's not changed. If I think of my oldest son, he's 42 now, but if I look back and I think about, I was equally as terrified, but there is also that essential bit about debriefing, especially if the outcomes in your birthing experience aren't what you expected. Where do you take that to? You know, so many of us have that wonderful image that we're going to give birth and it's going to be perfect, and it isn't perfect, and it's quite traumatizing. So you do often need the chance, even if it isn't mental health, just to debrief. You know, I remember having, you know, I didn't expect to have a cesarean the first time that I was giving birth, and it ended up in a cesarean. Well, I felt totally useless. So I think it's really, really important to be able to go to someone, be able to express those fears, um, and have a debrief and actually understand why it didn't go as you expected. And I think just doing that would be, you know, before you get to mental health support, just debriefing would be fantastic for many women.
Yeah, for sure.
But
Gosh,
of
I could,
course, there are mental health support that is needed as well.
yeah, I could talk your ear off on this. I really could. I mean, God, you throw breastfeeding or not breastfeeding on top of that as well, and my
Mm,
gosh.
mm. And you
Um,
know, one of the things we found is in our recent is that, you know, when you think about health visiting now and some of the services that we used to have post birth that actually focused on public health messages, supporting women with breastfeeding. I mean, I'm a health visitor. The amount of times I used to go in and people would say to me, I can't breastfeed. And I'd say, but actually, if you were in the wilderness, you would. And let's have a go at it and let's try. Um, just even having the services, but it feels as though rather than focusing on some of those public health good things, we put, you know, health visiting to focus on child protection. And I'm a great advocate for child protection because obviously I spent a huge part of my life. But public health is public health, and you do need to have, you know, those school nurses, those health visitors helping women and supporting women with some of the public health messages, whether it's nutrition, all of that preventative uh, issues that I used to deal with a health visitor seems like not there anymore. And this is what women have told us, certainly in the last review that we've just done. Women are saying that more support is needed, particularly in the postnatal period.
Absolutely. Oh, thank you so much, Donna, for sharing your insights and your leadership with us today, and for your dedication in this work as well. It makes me feel so much better knowing that you're in this space. It really does. But before we wrap up, I want to briefly take a moment to highlight GS's 333 Pledges for 333 Lives campaign, which is the number of stem cell transplants that are performed on average every month in the UK. And thank you for your background image and for spreading the message for us. This campaign aims to address the stark underrepresentation of Black people on the donor registers, and it takes less than 5 minutes. And by pledging today, you can make a life-saving and long-lasting impact this Black History Month. So please click on the links provided to learn more and take the pledge. And stay tuned for more episodes of Leadership Lens, where we continue to explore and champion diversity and inclusion across various public sectors. Thank you for watching, and another huge thank you to you, Donna.
Thank
Uh,
you.
Goodbye and see you next time.
Thank you.